point, what is the difference between a cyst and a lipoma? The fact of the matter is sometimes it's difficult to tell. I had a patient the other day who had thought they had a cyst and it was a lipoma, and it can work both ways. So you know, when you're making the incision over it, it doesn't really matter. If you're doing it endoscopically, it does matter. So I'm guessing an endoscopic one would probably need a scan to ensure that it was a lipoma, because if it turned out to be a cyst, then you wouldn't be able to get that out endoscopically, I wouldn't have thought. So the difference is a cyst is a skin lesion, whereas a lipoma is something that's beneath the skin. So a cyst is kind of within the skin. So there's often a punctum. It can be difficult to see, but a little hole connecting it to the skin. So it's kind of connected to the skin. So you can't really move the skin over a cyst. A lipoma is deep to the skin. It can be right underneath the skin, but a lipoma could potentially be at any level. So it can be quite deep lipomas. So that's one issue with lipomas, certainly on places like the trunk, on the abdomen, they can be quite deep. So unless you can really feel it nicely, sometimes we do want a scan first to delineate what it is, but also to get an idea how deep it is, because they can actually be underneath, within the muscle, intramuscular, or sometimes beneath the muscle, and they can be in different layers. Obviously, the deeper it is, less problem it's going to give you. So a deep lipoma, you're less likely to have symptoms from. But if there is a big one and you want it removed, sometimes we do ask for a scan for that and other reasons. But the difference, clinically speaking, as a doctor, you don't have to worry about it, because if you've got a lump, you just have to go to the doctor and say, I've got a lump. You don't have to really worry whether it's a cyst or a lipoma. I wouldn't worry too much about it, because it doesn't really matter that much. But the difference is that the cyst is kind of attached to the skin, the lipoma is underneath the skin. It can be difficult to tell. And you know, sometimes you might think it's one and it turns out to be the other. It doesn't, as I say, it doesn't matter that much, because the treatment is similar in terms of excision. Potentially maybe a slightly smaller scar with a lipoma than a cyst, because you're not so worried about breaching the cyst wall and removing the cyst wall, so you can sort of squeeze it out. But as I say, if they're deep, you might have to make a slightly bigger incision. So 6 2/3. Yeah, so that's how you tell the difference. You try and move the skin over it, but as I say, from a patient point of view, it doesn't matter greatly.